Now, I'm going to introduce you some statistical terminology, and we will start with very simple ones, namely the incidence. Incidence, most of you, almost all of you, I suppose, know what incidence is actually. It is the number of new people developing a disease, new people, new diseases within a population under risk, within a certain population. So if we are talking about diabetes, the incidence of diabetes within 1 year, that means in our community, what is the percentage of people developing diabetes within the last 1 year? If, let's say it is 1%, one, that means if the incidence is 1%, it means 1% of that population with some population size X will develop the disease within 1 year. The prevalence, on the other hand, is the new and old patients together. So all people in the population, in the community, in the group under risk, we call it, group under risk, having the disease. That means if we are talking about diabetes, what is the proportion of adults in our community having diabetes? That might be much more, of course, 15% maybe. This we call the prevalence. Then we have something called the relative risk. Relative risk is the division of those exposed to the risk factor divided by the unexposed. So some people smoking and getting lung cancer, some others not smoking, and they also get lung cancer. So what is the proportion? What is the proportion of a smoker to get lung cancer? Lung cancer is very rare, you know. It might be 0.005%, I would say. We may check it, but I suppose it is approximately this amount. And if this is the proportion of those exposed, the proportion of the non-exposed is, of course, much lower. So let's say it is 1%, 0.001%. And if you divide these two numbers, it will be 5. So that means the relative risk of tobacco smoking in causing lung cancer is 5%, could you say? There is a beautiful web at the first sight looking very complex, but very good explained, I believe, on Wikipedia. So I suggest you to stop this slide and go through all these abbreviations and try to understand them, or look at maybe they have a newer version on the Wikipedia. Here I will, on behalf of this slide, I will try to show you the risk reduction, what it means. We have an event rate. This event rate here is 10%, the event of having a disease in the people getting a medication. In the other group, in the control group who don't get the medication, the event rate is 40%. So if I would ask you, what is the risk reduction, absolute risk reduction, that would be, of course, 40 minus 10. That is then 30%. 30% absolute risk reduction by administering a medication to that group. Absolute risk reduction is important because using the absolute risk reduction, we will be able to calculate the number needed to treat. 1 over absolute risk reduction will give me the number needed to treat. Here it is 3. 3 people, that means if you calculate the number needed to treat, that means 3 people, you need to apply this medication, whatever you give in the experimental group, compared to the control group, to save 1 person from getting the disease or the risk or the complication. So this is comparatively very low, I would say, NNT, number needed to treat. Sometimes when the percentages are not so high as here, 40, and 10, especially the medical companies, the drug companies, they prefer to present you the relative risk reduction instead. Relative risk reduction is, of course, the risk reduction relative to the people with the event and with, compared to the control group. And I advise you always, if you hear the relative risk reduction, ask also for the absolute risk reduction, because sometimes that's more important for you. From the absolute risk reduction, you may calculate the number needed to treat. Then we have the risk ratio. Risk ratio is a simple division of the event rate of the control in the control group to the event rate in the experimental group. And we have the odds ratio. Odds ratio is a little bit more complicated to calculate, but I will show you it in a second in another slide. Okay. An example to use the number needed to treat, NNT. Here, this will make it very clear to you, I believe. We are interested in the stroke rates of people with hypertension, diastolic blood pressure above 115 in 5 years. If they don't get any medication, the risk of having the condition is 8.2. Now, if I give them antihypertensive medications, I can decrease the risk, although it will not be zero. I can, let's say, in this, according to this study, we can decrease it up to 4.7%. The difference between these two is my absolute risk reduction. Very simple, isn't it? This is 35%. So 0.035. So 3.5%, sorry. 3.5% absolute risk reduction I will be able to achieve by administering the medication. Since number needed to treat was 1 divided by absolute risk reduction, my number needed to treat here, in this case, is 29. That means what? You need to apply antihypertensive medications to 29 people to protect 1 person from getting stroke. Is that feasible? I would say yes. 29 is not so high number. You can treat 20 people with hypertension to protect 1, to prevent 1 stroke. That's very good, I believe. And thus antihypertensives are easily available, not so expensive, and don't have so many side effects. So considering all these factors, I would say, yes, that's a good idea. But another example here from Germany, in a German national guideline, they have the NNT for preventing a rheumatic heart disease in sore throat in people with streptococcal pharyngitis, tonsillopharyngitis, is 5,500. So you must treat 5,500 people with antibiotics to prevent 1 rheumatic heart disease. And if you have this kind of very high figures, very high number, and besides, the medication you are administering, in this case penicillin, has some complications, then of course the Germans, they advise against administering antibiotics for sore throat to prevent rheumatic fever. Okay, I hope that made it clear to understand. Of course, risk reduction, when we say risk reduction, we have also risk increase, and that, but once you understood the risk reduction, you will easily understand the risk increase. The only difference is instead of number needed to treat, here you have number needed to harm, and the rest almost the same rules apply. Okay, another break, and then I will continue with the rest of my presentation.